Obesity is a disease, and it's a complicated disease. When we look at people who have weight problems, there's an overwhelming urge to blame them for having the problem and urging them to lose weight, when the fact is that there's a complex series of mechanisms that stops people from losing weight. And by understanding what those mechanisms are and how to defeat those counterbalancing systems, we're going to be able to treat obesity very effectively in the near future. We see patients regularly who have been trying to lose weight in every way possible, but they've been unable to do so. Many of them have already had surgery and they failed surgery. And to be able to get someone like that to lose weight when they failed surgery, that is very gratifying. And it's because we now have new tools that weren't available just 4 or 5 years ago. That's what's really been exciting to me. So to see someone who has been suffering from their obesity and now they're down 20, 30, 50, 70 pounds, it's just an amazing thing to be able to do. We have a 12-year-old, a young woman she came at 12 years old, she was 260 pounds. Now she's 16, she's 160 pounds. And her family is extremely grateful. And the treatments we're offering are not the same. It's not eat less, exercise more. It's very customized, sophisticated forms of treatment that break through in ways that we haven't been able to in the past. People come to us because they have a problem, and we treat them, and all of a sudden the problem is gone. And it's like, oh my God, I can't believe that this problem is finally gone. Like, this is unbelievable. And they're so grateful they can't do enough for you. And finally, in our field, we're beginning to see that. Our interpretation of some of the research going on, both at our institution as well as at other institutions, is that there's a feed-forward mechanism that drives obesity and the obesity epidemic. In other words, that when you start eating fattening food, that it begins to disinhibit certain systems in the body that drives more eating. So that when we look at certain factors that seem to drive the obesity epidemic, that people are eating more food than ever, we think there's a physical component to this. Not just that it's a behavioral problem, but that once you start eating that way, you can't stop. You feed forward into this problem, so that the more you eat, the hungrier you get, the more craving you have. And this is a new idea, the idea that something environmental and behavioral turns into something physical. That's what makes it so hard to treat obesity and the obesity epidemic, is this physical component which we've grossly underestimated. If you look at the most exciting developments in the area of diabetes and obesity, it's combining different treatments: surgery, less invasive surgical procedures, and medications that we have now and medications that are currently in development. Putting those together to get better results. That, in my mind, is the most exciting potential. And we're perfectly set up here at Weill Cornell to move forward in this area because we have some of the leading people in the world in all of these areas. If you look at what we're doing, what Dr. Rubino, Dr. Pomp, and others at the institution are doing, we're perfectly positioned to be world leaders in this area. We know what we're doing, and I think that when we put it all together, given our understanding of the problem, we're going to get better results than anyone has ever seen. And just to give you an understanding of what we're talking about, in the past, if you had diabetes that was bad, you were going to gain weight. So you were going to be treated with insulin, and you were going to be gaining weight. And we don't look at it that way anymore. What we want is someone who's being treated for their diabetes and they're losing weight, because we know that losing weight is critical for overall improvement in the functioning of someone with diabetes. And by focusing on that as one of the key benefits, my colleagues at Weill Cornell and I have been able to make huge breakthroughs in the health status of our patients. So by focusing on that one thing, that when someone has diabetes and he's being treated we're going to be sure that that person loses weight, we've been able to really make a lot of progress in the outcome for our patients. And I think we're just beginning to see how good this can be, because what we're doing now is taking what we've learned and what we've been able to apply in small numbers of people. Now we're going to apply it to large groups of people. I think that Weill Cornell is a perfect place to develop this type of a research environment. I think we're on the verge of really having a perfect setting to develop a diabetes and obesity research environment because of the people who are here, because of the philanthropy that is possible. There are just so many things that are right at this point in time that could propel us forward that it's just scary to think about. It's been very underfunded compared to some other areas of medicine. So when it comes to the magnitude of the problem, the number of people affected, obesity and diabetes are relatively grossly underfunded, and we need more money to do the kind of work that we want to do.